FEX acknowledges the Aboriginal and Torres Strait Islander people as the traditional owners of the land that we are all on today, and extend our respect to elders past, present and emerging.
And Rex respects ngā iwi Māori as the tangata whenua of Aotearoa and is committed to upholding the principles of Te Tiriti o Waitangi, fostering the college's relationship with Maori, supporting Maori fellows and trainees, and striving to improve the health of Maori.
Thank you. So our panelists tonight are Dr. Paul Pincus, Deputy Chair of the Court of Examiners based in Australia, Professor Sue Stott, Deputy Chair of the Court of Examiners based in New Zealand. We have Dr. Greg Keogh, Deputy Chair of the Court of Examiners based in Australia. We've got Desley Ward, sorry about that, Desley, General Manager of Assessment, Prakash Bidel, Examination Coordinator, Anna Parkin, Interim Executive General Manager, Education Pathways, and we've got me, Mishi Jaganaiklu, Examinations Manager. We'll first run through the uncoupling of the exams, and like I said earlier, we'll take some questions after this.
Okay. Hi, my name's Paul Pincus. I'm one of the deputy chairs of the court, and I'm just going to talk about uncoupling of the exam, which is a new something that's brand new, and I appreciate that it's both uncoupling and unsettling. Just to go back just a couple of steps, this was something that was requested of us as the executive. It brings us in line with the College of Anaesthetists and the College of Physicians, and it recognised that if candidates presented to this exam and fail the first two written segments, their actual chance of passing the whole exam was very low, and it became a very expensive process to do through when you weren't going to pass. So this is our first go at uncoupling, and we as an executive would be the first to accept that we haven't probably done it perfectly, but we've got something that's going to function for us this year. So the difference is that if you sit the written exam and you are a candidate, you fail the two written segments, you will not progress to the clinical viva component of that sitting. If you pass all written segments, so you pass both your written segments but fail the overall exam, you will bypass the written component of the next scheduled exam, sitting as a one-time exemption and progress directly to the clinical viva component. Candidates who do not progress to the clinical viva component, that is, candidates who fail two written segments, will receive a partial refund of the examination fee after the conclusion of the clinical viva, in accordance with the information published on the college website. Candidates who are only required to sit the clinical viva component will pay a reduced examination fee. Again, this is information published on the college website. Candidates who can't attend the next sitting of the clinical viva on medical grounds, or there may be other reasons, must contact the exams department via email so the circumstances and supporting documents can be evaluated on a case-by-case basis. And finally, candidates will be notified via email regarding their progression to the component approximately 2 weeks prior to the scheduled start date of the first clinical viva. So there's a lot of information on that, and the next slide has got it in a picture format, and so I'm going to go through that information again on the next slide, and then I'm going to stop speaking because I think that this is confusing, and I want everyone to be able to be comfortable that they know what's going on. So this is a representation of what we're doing. So at the top is you get approval to sit your fellowship exam. If you have paid and you aren't allowed to sit, then you get a full refund. So let's move on to the written exam. So the options are on that next row. You can pass both written segments, you can pass one written segment, or you can fail two written segments. If you fail two written segments, you'll get a partial refund. You must take the written exam at a written component at the next time that it's available to you. If you pass both written exams, so if we go all the way to the left of the slide, then you go and sit the clinical viva component. Then there are two possibilities. If you pass, then you go on the pathway to fellowship. If you fail that exam, so you have passed both written and you fail the viva, then you skip the next scheduled written component exam and you get another go at the clinical viva component. That's a big change for us. If, however, you're in the middle row where you pass one written segment and then sit the clinical viva, again, if you pass that, then you're on the pathway to fellowship. If you fail that exam, so we're in the middle column here, then you have, and you've only, if you failed that exam, you've only passed one written segment, then you have to resit the written exam again. So this is exactly the process that the College of Anaesthetists and the College of Physicians go through. So I'd like to open the forum up to questions now. I'm not sure that I'm going to be able to see the questions or hear them, but let's see how we go. Are there any questions?
There are no questions right now on the chat box here, but
so could I say, I think the one thing that we've haven't really got quite right is that the timing of this is really not ideal. It's pretty tight, and we will be working on that next year. Now, there is a question: when will we know if we pass one or both going? Will we know? No, you won't know, because we think that it would be put a lot of pressure on you if you knew that you had passed only one segment of the exam, and so you won't be told until after. If you've passed one segment of the exam and you go on to pass, you'll never know. If you've passed only one segment of the exam and you fail, then you'll be told after that you don't have to, that you do or you don't have to sit the written again. Now, the next question is, by partial refund, can you confirm it is a 50% refund? Amishi, do you know the answer to that?
I know the answer to that, and that's correct. It's 60% if you don't progress to the viva. And if you need to skip the written, then again, you will only pay half of that, the overall fee.
Now, the next question is, I've already answered. When we get notified on May 17th, will it tell us if we passed one or no? No, you're not going to know that. Does passing the theory exams have any influence on passing the viva? That's a really good question. We all feel that one of the things about the uncoupling of the exam is that, to some extent, the written exam and the vivas are really different exams. The written exam is really a lot of knowledge based, whereas the vivas, we're really looking at higher ordered thinking. So passing the theory exam, certainly we know that if you don't pass the written exams, then you've not got a high chance of passing the viva, but there's no other influence between the two. Now, the next question, and with relation to finding out 2 weeks before the clinic, is your specific clinical or all clinical? The New Zealand clinical is a week before the Australian. So I think that you, Michi, correct me if I'm wrong, but people have already applied to sit the clinical in Australia or New Zealand.
Yes, they have. They will be notified 2 weeks prior to the New Zealand exam.
Yeah.
Which is 3 weeks for the Australian exam.
that's all questions for now there.
Okay, rightio. Well, if anyone thinks of more questions, we are going to have time at the end as well. So I'll pass it on to Sue.
Okay. This is just some details about the written examination on the day of the exam. So you do need to register for both the morning and afternoon sessions. If you have a pre-approved reasonable adjustment letter, which is something you would already have applied for, you need to bring that letter at the time you register for the exam on the day. We do need a form of identification with a photo, driver's license, passport, hospital ID. If you don't have any of those, you need to complete a declaration of identification form. All mobile phones and smart watches, analog watches, will need to be surrendered at registration. And we ask with the analog watches because some of the smart watches look very similar to an analog one. It's hard to tell the difference. You can have your mobile phone for use during the break between the 2 examination sessions if you like. If you're late for the exam, You can start up to 30 minutes after the scheduled start, but you don't get any additional time if you arrive late. And probably the biggest point to notice is if you have any issues with your PC, then please inform the invigilator immediately and they can relocate you to another PC, and that you will be compensated for that time. So it's really important that you let us know if there's any issues with your PC, because we can't help you unless we know about it. So immediately let the invigilator know. And I think that's all of the slide. Yeah. Clinical Viva, I think that's handing on to Greg. It's Greg? Yeah.
It is. So
Yeah.
presuming you're accepted for the clinical, the Vivas, again, arrive with plenty of time, ideally 15 minutes or maybe even a little bit longer before your segment begins to, one, register, and usually the senior examiner and or staff from the college will come out and give you some information on the day about the particular Viva, the process involved once you head through the door. There will be signage and marshals from where you arrive at the building to where the examination area is. Again, we need photo ID to prove who you are. You get a candidate badge number when you arrive, and that badge number stays with you as your passport, if you like, for the whole clinical exam. And the examiners will only know you by your candidate number. So it's important when you do come to the exam, whichever segment you're doing in the clinical Vivas, that badge is with you and that people can identify you by that. Again, all mobile phones, watches, timers, electronic devices will be collected and stored for you and will be returned when you leave the post-examination waiting area. Depending on where you are in the rotation, there are usually a number of sittings. We have 3 candidates per session usually. So the first 2 lots will be held in quarantine prior to when the third group of examinees goes in. You'll be given tea, coffee, biscuits, but there will be quarantine between those who are about to sit the exam and those who have finished the exam. So there will be a rotation of candidates through various rooms during and after the exam. And again, you'll be able to pick up any of your textbooks, notes, etc. Once you finish the exam. If you do need to use the bathroom after you've got your Viva, but while you're still in quarantine, we don't prevent you from going to the bathroom, but a marshal will accompany you, not necessarily into the cubicle, but certainly to the bathroom. Next. As far as the exam, and for those of you who may have sat before, you may have an observer in the exam room during the exam, and there are a whole bunch of people who we require to be observers prior to examining. So it might be a newly appointed examiner who is there observing how the exam runs. It may be one of the people you can see on the screen at the moment. It may be an examiner from another specialty or a fellow from a training board, or possibly an overseas person on occasion. And that's really to make sure that there is standardisation of the exam across all specialties. There may be other observers appointed by the chair of the Court of Examiners, which is currently Ray Sachs, and you may, in your particular Viva, have a representative from your local training board or committee. New examiners really do attend for the training, and other observers are there to make sure that there's reliability, validity and fairness in the exam process. And the observers have no input into you as a candidate as far as your assessment or the marking. So they're there literally as observers. As far as conflict of interest, I think it's really important we know about that prior to the exam. So there's a list of examiners on the college website for your specialty. And it's important you have a look and make sure that there isn't a significant conflict of interest with examiners. If there's any doubt, ask for both the written and the clinicals, because some examiners may examine you in the written papers only. they don't necessarily know who you are, but if you think there may be a bias, it's really important that we know about it. Examples of that may be a family relative. That's a pretty significant conflict of interest. It may be that one of the examiners has been your MD or PhD supervisor, so you have a close relationship. Having been a trainee under that particular examiner doesn't necessarily constitute a conflict of interest, so it's important that we at least know. And contact Mishi or a member of the examination team if you feel that there is a conflict. And if there are conflicts on the day of the exam, it's important again to flag that to the local coordinator.
So I'm going to run through a few FAQs. I know there's a few comments in the chat as well, which I'll come back to, but there's one question: how is a newly appointed examiner able to hold a senior examiner accountable for their conduct in the exam? So remember, the newly appointed examiner is there for training and learning purposes. So they're really watching more senior examiners to see how the process works. So that's what they're there for. They're there for their own training and observation prior to proceeding to be an examiner. Okay, so I'll run through the FAQs, then we'll go back to the rest of the questions. So when will the timetables for the clinical viva be sent? Provisional clinical and viva venues for May 2025 will be sent out in the next 2 weeks, and we don't confirm that until the final timetables come out in early May. We release the results to candidates on Monday, the 26th of May for the Auckland exam, and Monday, the 2nd of June for the Brisbane exam. I saw some people asking about reading time for the written exams. There is no designated reading time. Candidates may begin as soon as you're instructed. Will you have pen and paper? I noticed some people asking about pen and paper. Pen, scribble paper, and hard copy of the question will be provided both for the paper-based and the computer-based exams. You must leave those in the room at the conclusion of the exams, and please note that the scribble notes will not be marked, so don't put a whole answer on one of those pieces of paper because it won't be marked. It won't be seen by the examiners, but certainly you'll have paper to jot down any thoughts at the beginning or through the exam. Toilet breaks. If you do need a toilet break, you must raise your hand to alert the invigilator and they will escort you to the bathroom. We don't permit toilet breaks in the first 30 minutes or the last 30 minutes. That's really about not distracting other candidates in the first 30 minutes reviewing the exam, and in the last 30 minutes finishing off the questions. If you do have a question about the written exams, you're required to submit an inquiry form. And Mish, how does that work? Is there a paper requiring inquiry form? Is
The
that what
inquiry form is going to be with the invigilators in each room, and you can fill that out at the end of the exam, and that will be passed on to the senior examiners.
Okay, all right. Okay, another slide, I think. Yeah. So what can you bring into the exam rooms? If it's computer-based, you don't need to bring anything. If you're sitting a paper-based exam, pens will be provided. If you bring your own pen, we'll inspect it at registration. Can I register earlier than my allocated time? You won't be able to register early, so please arrive at the designated time. When you're sitting at your computer, if you have problems with your RACS ID and or password and can't log in, just try and type it slowly, make sure it's correct. But if it doesn't work, you must advise the invigilator immediately. Can you leave early if you've finished? No, you're not permitted to leave the exam room early, except in case of illness. Can you use symbols like greater than instead of typing it out? Yep, that's fine. As long as the symbols are appropriate and they're widely known. And again, with abbreviations, they're also acceptable as long as they're widely understood and used within your specialty. But please don't use abbreviations that examiners may not be familiar with. Yeah, and let's see now. Can we start on the chat? I think there's some things. Can we flow back? There's some
We can
questions.
start from there are no resources available at the college website. For example, practice questions for theory-based exam on the new structure. So you can start from there.
Sorry, I'm just scrolling now.
That's from Dr. Amit Tripathi.
There are no resources available at the college website. Practice questions.
Can you scroll down so that we can see the questions, please? Oh, no, I can do it. Sorry.
You can do it. I think you can do it. So is that what we're up to? There are no resources available at the college website, for example, practice questions for the exam based on the new structure.
Yep.
Do you want to speak to that, Mish? I thought that for some specialties there are old questions.
We have some questions in. So I'm trying to find a question here. I'll just put it to share on the screen so we can all see the questions. So the format of the exam hasn't changed. So there's no change to the actual content of the exam. Everything that is in your notes to candidates is valid. And we have some resources available that's always been available on the website. I'm happy to, at the end of the webinar, send an email to everyone with the links to those resources. If you can't find it, just reply to my email and I will get in touch with you.
So essentially all we've changed is the timing of this exam. We've literally uncoupled the written and the clinical viva, but we haven't changed the structure of either exam in terms of what we're asking or how we're doing the questions. If you are resetting only the viva component, will the fee be reduced? I think we've already answered that, haven't we?
Yes,
Yeah.
we do 50%. So if you don't progress to the clinical viva, you'll get 50% of the fees back to you.
Yeah.
And if you're only required to see the clinical viva component at the next exam, you will be only required to pay half of that amount upon registration.
And then a question, Mish, maybe for you, can we bring any medications inside like Ventolin and Spacer?
Obviously you can. It will be inspected upon arrival. Just make sure that at registration, you let the invigilators know.
Okay.
I'll take the next one as well.
Okay, yeah.
So we do have earplugs available on, no headsets, but earplugs will be available at the exam venues.
Okay. And the next one is pen and paper, but I think we're saying, yes, there will be. So even for the computer-based exam, there'll be pen and paper, Mish?
Yeah, there will be pen and paper. They can ask. So they can ask for, if you don't like the pen that Clifton provides, there's quite a few pens available in the room.
Okay. And I think someone asked, do we have time prior to starting the exam to write down with pen and paper our own personal timing? I think the answer to that is no, that actually there's no, you start that when you start the exam, that's when you can write that down. Yeah.
Yep.
Okay.
So next one.
But I've answered the one about the newly appointed examiner. So they're there for training. They're for training and learning purposes. So they're essentially observing the examiners, not you.
And there is a feedback process, so that if an observer in your exam identifies issues during the viva with other examiners in the conduct of the exam, that's reported through to the senior examiner on the day.
Could I just add that if it's a newly appointed examiner who's done their observership and is examining with a senior examiner, so they are actually examining, there's no holding to account. In fact, the opposite's likely the case. The senior examiner, the more experienced person, may have to aid the newly appointed examiner in their conduct, but there's no issue between. Our senior examiners are all experienced and their conduct should be excellent during these exams.
Okay. Re-ENT, how many weeks in advance will the Australian candidates be invited to the clinical, since the NZ candidates will be flying to Brisbane for the same clinical exam?
So I think I can answer that question. So that relates to the exam. We have an exam that's held in New Zealand a week before the Australian exam. That is only for general surgery and orthopedic surgery. And that exam is mainly for New Zealand candidates. We do have a couple of Australians who fly over. So those candidates will have 2 weeks notice whether they can sit the clinical viva or not. For somebody in OHS, for example, you will be advised whether you're based in New Zealand or based in Australia. You have 3 weeks notice before the clinical viva.
And this one's probably relating to the discussion around conflict of interest. How will an examiner know who you are in the written exam? Is it not anonymised? Yes, it is anonymised. They will have your exam paper with an exam number on it, so they won't know who you are.
One of the issues, though, with conflict of interest is we don't know in advance. If you have a conflict of interest with a particular examiner, we don't know whether that examiner is going to be marking your written paper or whether they're actually going to be in a viva. So it is more likely that we can assign a conflict of interest examiner to a written rather than trying to shuffle around the vivas. So that's how it works.
What is the average typing speed required to be able to complete the exam on time? Is there an option to perform the exam via paper instead of computer if you feel you are not fast enough typist? Do you want to answer that, Mish?
I don't know the average speed required to complete the exam, but there is always an option to do the paper-based exam, and that was at registration, candidates had the choice. They could have let us know, and they could have put a reasonable adjustment to swap from a computer-based to a paper-based exam.
But I think at each venue, Mishi, isn't it correct that you'll have paper exams available on the day?
We do have them as a backup, but by now we should, according to the policy, we should have been notified if a candidate wanted to have a paper-based exam.
Yep.
Just to get organised and get everything sorted. If you are that candidate and feel like you need a paper-based exam, please reach out to the examinations department as a priority so we can have a bit of a discussion on that. Thank you.
Yeah, thank you. Yeah. How can we draw a diagram or a flow chart as an additional part of an answer when doing the computer-based exam?
You will be provided with diagrams for paper if required as part of the exam for your specialties.
I guess I've lost my questions now.
So
Is the RACS ID and password provided, Mish?
this will be provided at the exam. You'll have it on the day of the exam on your desk.
Okay. Next one might be for you, Greg. There are no past exam questions for general surgery available.
Correct.
Okay.
We're working on that.
Yeah.
For this exam, correct.
Yeah. Can we wear earplugs? I think we've covered that off. The answer is yes. So we will supply them, won't we, Mishi?
Yes, we do.
The candidates could bring their own and have them inspected.
We'd rather use the one that we have because of all the technological advances that's around. We will be providing the ones. Clifton's provide some, and if you're taking the exam in Adelaide, and you'll have them at the RAC's office as well.
Okay.
I could answer the next one regarding observers. Not all stations have observers, and we actually try to make sure that not more than half of your exams are observed. So most of you will have most of your exam without observers, but all of you will have some exams observed. But you won't have every one of your exams observed.
Mishi, the list of examiners.
What I can do is after the webinar, I'm happy to send a link to everyone. That makes it easy to find it.
Yeah. And just confirming if candidates can go to the bathroom during the exam. Yes, you raise your hand, the invigilator will escort you, but not during the first 30 minutes and not during the last 30 minutes. But otherwise, yes. Is there a way to check the keyboards prior to starting the exam? I think they would all be checked by the college staff, wouldn't they?
We don't do those checks because there's too many, to be honest, but the venue checks them. And if you have a problem, please let the invigilator in the room know straight away.
There's just a comment about cardiothoracic. I doubt cardiothoracic has a paper-based exam. Okay. Okay. Are there any other questions apart from that? Is there, I had one more. Any Windows computer?
It's a PC. There's no Macs available.
Okay. All right. Water, Mish, again.
No more questions.
Water will
One more about water.
Yep.
Are they allowed water?
Available?
There'll be water in the rooms. What we tend to do, especially because you are on a computer, we ask that the water will be at the front of the room because you can easily knock water in as you go through your paper and just create a mess with the computer. So the water will be at the front of the room.
There is no more. There's one more question. It says, "Can we ask questions now about the actual exam?"
Can we ask questions about the actual exam?
Yep.
Yes, you can.
Yes.
I'll read it out anyway. Management means history, examination, investigations, diagnosis, treatment plan, follow-up protocol. Being asked to describe your management of a problem is fair game in an essay seems a bit unfair in Asawi's. There's a lot to cover in a short period of time. How does one answer a management question in Asawi? I think it's really going to be dependent upon what the scenario is in the Asawi, I think, as to what, and on the whole, we do try and have very targeted questions for the Asawis so that these are very short bullet point answers. Any comments on that, Paul?
No, I agree completely. Yeah, I mean, you'll see on the Asawis, there's a small place to write. There's not 2 pages, and we know that they've got to be done in whatever the time period is. So you'll just got to have to write a summary. You're not going to write a longhand essay. But the Asawis the questions are mostly pretty directed in those. So, but often you just write a 1-word answer. That'll be all there is, but the problem is candidates tend to write too much and they don't need to. They're just short answers.
Yeah.
That's what they're called, short answers.
I think just look very carefully at what the question is. If it says what is the most likely diagnosis, then we're looking for one diagnosis. If it says give a differential diagnosis, then we're looking for probably the top 3 or 4 differential diagnoses. So just be very structured like that. And if it's investigations, it's really just a list of investigations, appropriate ones. And the MRI scan, CT scan doesn't really need a lot of explanation around it. So I think that's very much a bullet point type answer. Yeah.
And for general surgery over the last few years, there's been a more focused type question where the STEM will delineate exactly what you're being asked to provide rather than all the information about a particular condition that you read about. So I think it's really important for both written papers in general to actually read the question because that will give you the guidance as to what you need to be answering. We have gone away from give us a list of, give us a differential diagnosis of. It's more about higher order thinking, putting stuff together, some synthesis is what we're looking for rather than lists of conditions. Okay.
Will that be different for computer and paper-based? Because you can write freely in computer-based, no restriction of words.
I'm happy to take that one. Your booklet, if you're taking paper-based exam, has quite a few pages for you to write your answer. And if you, for whatever reason, require more paper, there are booklets available, and these will be already in the room. You just have to raise your hands and ask for one or 2 needed.
Okay.
There's no autocorrect.
I don't think there is autocorrect, is there? No.
But there's an auto save, is there not?
There is an auto save, yeah.
Yeah.
There's no any other new questions so far. Oh, there's only one.
Oh, here we go. Have I got all the question on? Someone says, how does one best respond to this essay instruction? Bearing in mind, writing a policy is not something we've trained in, it's something that requires a lot of time and effort to do the policy. Write your management for the treatment of adult distal radius fractures.
Well, this is a higher order thinking question. And where we have 9 competencies in surgery, and this is testing other competencies other than thinking about a pure management issue. This is a perfectly reasonable question, and you may not have written many policies, but you can create one. You can have a treatment plan. It's really an algorithm. And you would have treatment algorithms. You just have a provide a treatment algorithm and slot it in to make it a policy.
Yeah. Yeah, essentially thinking about your question, essentially a treatment algorithm is, what do you do if it's open versus closed? What do you do if it's undisplaced, displaced? What are your indications for operating? That's kind of, yeah. So basically that's what it would have in it. So it's more than just saying, I look at this X-ray and I fix the fracture this way. It's more about talking about your general management principles, thinking about different features of the fracture you're managing. As Paul said, it's more higher order thinking because it's not just one treatment, it's actually integrating your treatment algorithms and plans and processes.
Yeah,
and you might also bring into it in hours, after hours, consultant, fellow, cost. You might bring all those things into your policy development as well.
Mm-hmm.
There is food, there is time between the two exams for you to eat. We do want you to all survive the day.
If you want to bring something, we do have very limited amount of fridge spaces at Clifton's and at the Adelaide office. So if you wanted to bring, I don't know, something that needs to be refrigerated, you could have that option, but it's a very limited space that we have.
And then another question about the neurosurgery exam. Can I clarify? The question says evaluate the treatment options, including the surgical approaches. I take evaluation discussing pros and cons. However, in a trial written, the feedback to my answer was I did not explain my own preferred surgical approach, which is a bit confusing. Does evaluate imply that we need to also describe the approaches? I mean, I would take that question, says evaluate treatment options, including the surgical approaches, to therefore be talking about different options for management of whatever it was, so which may be non-surgical or surgical. And then from surgery, they obviously want this discussion, if you are going to operate, what type of surgical approaches you might use and why you might choose one on one occasion, why you might choose one on another occasion. That's kind of how I'd read that.
I think mostly if you were asked to provide your preferred surgical approach, that would be specifically in the question. That should be specific. They want you to say to choose one. They'll say, describe the pros and cons and say which is your preferred method. I think that would be that would be a most typical way. Greg, would you agree with that?
Yeah, I agree with that. I think the operative word in this question is trial. It may actually be that you've had a question set by one of your supervisors who may not be a recent examiner. So I think it is tried and tested from a semantics point of view to make sure there isn't any confusion as to what's required in your answer. So I would make that argument. Particular question.
And just to reassure people, when we mark the writtens, if examiners see that a question has been confusing or has been misinterpreted by most of the candidates, we will then go back and look very carefully at that question and the responses to it.
Yeah.
So if we see that a question is, for whatever reason has confused everybody, then we actually will reevaluate that. So that, you can be rest assured that we won't simply mark everybody 0 because everyone's misinterpreted the question. But I think actually it's a good point that how reading questions is really important, because this says evaluate the treatment options, including the surgical approaches. So that's clearly signaling to you it's more than just listing the surgical approaches. It's actually talking about different types of treatment. And then if you are going to operate, what are your surgical approaches and why, and clearly why you might choose one in one circumstance and one in another. So that's good. Okay, can we bring our own keyboard? I think the answer to that is no, isn't it, Mishi? Yeah.
Good luck, everybody.
Yeah, it's a very stressful time for all.
Yeah.
So good luck.
So we know you've all prepared really hard for it and you're all, got a lot of knowledge. So good luck on the day.
Also like to say, sometimes we do this meeting and no one asks any questions. So it's so good that you're all prepared to ask questions, because, we come to these meetings to talk to you and answer questions. So well done to all of you who ask questions. Thank you.